So today in our primitive reflex integration series, we're going to get into primitive reflexes, symptoms, and the sensory system. So as we talked about in an earlier video, reflexes work on an arc. Sensory input comes into the body as an infant, and then the motor response is what is typically known as the reflex. So for Moro, the baby opens its arms, it tilts its head back, starts to cry. That's the motor response we think about. But the sensory input that caused that was either some type of movement, a loud sound, or tactile input like a cold diaper, something like that. So sensory input is directly related to how reflexes develop and how reflexes integrate. So that sensory input is what triggers the motor response, or what we think of as the reflexes. But it's this whole arc that works together. So when we're talking about sensory integration therapy and OT, it's really imperative that we work functional movements along with reflexes to get the most, best results, rather than just inputting the body with sensory input. Now we do input the body with sensory input along with doing reflex integration when we work the entire brain and the brain development to get these best results, because basically we're trying to rewire the brain in the same way that it developed. So sensory integration occurs with reflex integration. So that's just something to think about, how we move our body, how it develops the motor system, and how we move and react to our environment is directly based off of the sensory input we get, whether it's visual input, sounds, or movement. That's what causes our motor system to develop too. So everything's just so connected. And when we talk about symptoms too, I want to remind us that everything is connected here. I almost hate talking about symptoms as one-to-one. So my child has poor handwriting. Is it Palmar-Grass reflex? It's never just one thing. I mean, when kids have a learning challenge, a behavioral challenge, a sensory issue, or functional disconnection, like we talked about in a previous video, which we see with a lot of these kids with neurodevelopmental differences, they have multiple reflexes unintegrated. I really doubt you would just have one reflex, I don't know if I've ever seen it. Actually, I know I've never seen it. One reflex unintegrated and you're having issues. Yes, some adults might have one a little bit unintegrated, but they're going about their day and they're pretty fine. It's when you have two or more and you're having some concerns and some symptoms that then I would definitely be seeking out a professional to do an entire assessment on all the main reflexes. And not only that, but brain development. How is their balance? How are their sensory systems developed? How is their coordination? Do they have cross-lateral movements? All of these important things, and that's what we look at in our programs too, is just the entire brain, so not just reflexes. So let's talk about, I'll be looking over at my notes here, but some of the common symptoms. These aren't, to my knowledge, done, they weren't compiled by our research. I've just seen them in multiple different places from multiple different sources about what common symptom is related to each reflex. And as I talk, you'll hear a lot of them overlap one another, which is another reason we work multiple reflexes at the same time, because the symptoms overlap, the reflexes overlap, it's all connected. Moro reflex is a big one for fight or flight and sensory processing, especially hypersensitivity to sound, to touch, to movement. So car sickness, things like that, excessive blinking, hyper startle response, that fight or flight type of response, whether it's fight, like they run away, usually for kids, they're getting angry about something, flight, they run away, might cover their ears, or freeze, which is the fear paralysis reflex. We're not going to talk about that today, but that is another area that can occur with the Moro FPR. You can have impulsive behavior, anxiety, vestibular problems, so imbalance, dizziness, vertigo, being able to tolerate tons of vestibular input too, depleted energy, fatigue, mood swings. They could have tons of energy and then really, really low energy. Tons of energy and really, really low. So big, huge swings. They don't just change. They might be sensitive to foods. The tonic labyrinthine reflex, common symptoms, again, these are just common. Poor posture, they might be a toe walker, poor balance and coordination, poor eye control or visual perceptual difficulties, they might be afraid of heights, difficulty judging space and distance, poor concentration, fatigue while reading, motion sickness. These are common with TLR. With spinal galant, common is can't sit still, very fidgety, bedwetting past the age of 5, short-term memory problems, sensitive to tight clothing, especially around the waist, like tags and stuff like that. Difficulty coordinating your gait, your walk, attention and concentration difficulties. Sometimes it can contribute to developing scoliosis in kids or adults. They might have a body tilt to one side or chronic neck or back pain to one side. So spinal galant. The ATNR or asymmetric tonic neck reflex, poor handwriting, difficulty reading and tracking, left-right confusion, or they might be ambidextrous, so they don't have a definite dominant side. A lot of ADHD, OCD type of characteristics, difficulty copying, missing parts of a line when reading, so lots of visual issues, poor at sports or dancing or bilateral integration movements, eye-hand coordination difficulty. The symmetrical tonic neck reflex also shows poor posture, a lot of times like a slumped posture when they're sitting in a chair, tend to hook their feet under desks when sitting in a chair for support, they're clumsy, their eyes may fatigue when they're reading or really focusing in. This is definitely important if your child's missed crawling or had an awkward kind of crawl. They might sit in a W position with STNR still unintegrated. They might have difficulty with upper and lower body integration, might be a messy eater and poor organization skills. With rooting and sucking reflexes, speech and articulation problems, stuttering, difficulty swallowing and chewing, poor manual dexterity, so mouth is related to the hands, hypersensitivity around the lips and the mouth, involuntary tongue movement when they're writing, so again, hands and mouth related to each other, oral fixation, which could be chewing a shirt, could be chewing gum for adults, something like that. Palmar grasp is obviously a big one with fine motor skills, with handwriting, but it's also important with processing information, poor memory for details. Typically, kids not good with math or numbers. They might have a mixed dominance as well, might have some poor posture. So it's not all just, what it seems like it should be about. Babinski, you might have an awkward run, poor balance, can't press the toes into the ground. They might have had delayed walking, problems with sports that require balance or running, low back pain, maybe shin soreness, often like recurrent ankle twists and such. And those are kind of the common symptoms that go with each reflex. And there's other ones you might hear of, and obviously as you see, they very much overlap one another. And as I said at the beginning, it's never just one, right? So even TLR was related to some of handwriting, and then you have palmar grasp, which was related to handwriting, and then you have the mouth, which is related to your hands too. So you would never just want to be working one reflex. You want to be working with a program or with a reflex practitioner, professional that understands reflexes and how each one relates to one another and how you can work them all together in a great program. So I hope that helps. And then tomorrow is the last video in the series. I hope to answer a lot of the questions that have been asked along the way and kind of summarize everything up in that last video. So go ahead and comment below or DM me with any questions. Thanks.